My name is Sherry Guess, and this is the Heavily Metalled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware, diet, and environments. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome back to this episode of the Heavily Metalled Podcast, where we are going to bring you my friend Emily's story from Connecticut, clear across the United States. Did you get to see the eclipse over there, Emily?
No, I wasn't feeling the best. I looked outside and I saw part of it.
Were you in the path of totality there? I can't remember where it all ran through.
It wasn't very dark over here. It was just a little cloudy and things looked weird, but it wasn't completely dark.
Yeah, like your vision was funny. I'm donning my eclipse t-shirt. It was awesome. It was super, super cool. We were in the path of totality and we did not have clouds, which was, well, we had clouds. They just went around the eclipse. So it was awesome. But anyway, welcome everybody. Welcome, Emily. Thank you for joining us today to tell us your cool story.
Yeah, absolutely.
Why don't you tell us a little bit about yourself and maybe share something about your hobbies, what you do in life, your family, give our listeners a glimpse into your personal life.
Right now, I'm going back to school for the 6th or 7th time. I'm finishing my bachelor's degree in nutritional science at the University of Connecticut. So I go to UConn. And I'm starting a PhD program in the fall that'll be nutritional science, but it will be food science specific. So I'm going to study food science.
Dr. Emily.
Mm-hmm.
That's going to be awesome. And we need so many more Dr. Emilys that know about metal hypersensitivity, especially in regards to the low nickel diet. That'll be amazing. We'll talk about that as we get into this interview. Do you have any kids? Are you married, single?
Married, yes. No kids. I have 3 dogs. 2 that I rescued, and then I have a cat that I've had since I was 19, and obviously she's older now. I'm a
What kind of dogs are they? Are they mutts?
Yeah, they're all mixed breed. One is a teacup chihuahua that I actually got for free off Craigslist because I was a little worried that they were going to use her for dog fighting. So I scooped her up and figured if it didn't work out with me, somebody would adopt her, but we love her, so we kept her.
They use chihuahuas in dog fighting? For real?
I feel like they use any kind of dogs for bait, especially if they're free and you don't charge a rehoming fee, which is something that I get a little nervous about when people aren't doing that.
Yeah. I have Great Danes and I worked with Great Dane Rescue for a while. And we do see some of the dogs that are kept from the fighting circles that are Great Danes. But I always thought they had to be bigger dogs. So thank you for rescuing the little puppies. Nobody should be hurting the 4-legged friendlies. Okay, so we'll come back and get more detailed in a minute, but briefly walk us through your health journey. Particularly focus on when you first started noticing symptoms that were related to metal hypersensitivity, and then we'll come back and do a deeper dive on each of the issues as we move on.
Yeah, I think even as young as in my early childhood, I didn't wear jewelry a lot, but anytime I would wear earrings, it would just irritate the heck out of my skin. It would be so red and so itchy, and I couldn't wait to take them off. My mom, actually, she's always had super sensitive skin too. And she was saying, oh, you're just allergic to cheap metal. That's what it is. If I did get jewelry, it tended to be on the nicer side of more expensive metals. And it still irritated my skin no matter what. And then I didn't wear earrings for a long time because they hurt. So in 2019, I decided that I finally wanted to get my nose pierced, because I had always wanted to do it. And I had a friend that I was working with and she pushed me into doing it. She brought me to her favorite tattoo and piercing place and I got it done. And I was really excited because I loved it. I picked out a cute stone. It was tiny, barely noticeable. I was like, this is great. Looks cute. I got a good nose for it. And then the amount of worse that I was already feeling intensified really fast. So within the few months after that, I got diagnosed with systemic sclerosis or scleroderma and then Hashimoto's. I know some of those are related to nutrient deficiencies, but my joint pain and other things was just compounding. And I started getting this rash across my face that was raised. And I never really put it together until a couple months ago when I took out my nose piercing and then the rash started to disappear and my face isn't raised anymore. It gets a little red like from the heat sometimes, but it doesn't get red like it used to.
And then you also had a mercury amalgam issue, right?
Yes, I didn't really have a say in getting those put in. I think I was 7 years old. I had a lot of fillings done, some of them on my baby teeth, which fell out, but I had two on the top that stayed in my adult teeth. I had wanted to get them out for years. I had this feeling. I just knew I needed to get them out. And then I actually found your podcast and I was like, I have to get them out of my head. I need to. It just,
I was going to ask you how you found me because you wrote me early on. And at first we knew nothing about the nose ring, which we'll get further into this as we go. But originally you reached out to me and it was about your amalgams. How did you actually find my podcast?
I feel like I had searched for something about mercury filling removal because I had been looking for a while for a dentist because I was thinking about getting it out. And I think it came up in my algorithm on Facebook that it was just like, here's this podcast. And I was like, what's this? And then I clicked and I was like,
oh, cool.
I really have to get them out because when I looked at the list of all the foods that people usually are sensitive to, I was like, those are a lot of foods I can't eat. Those are a lot of things that cause me problems. Yeah. And I was like, okay, I don't know. I listened to an episode and then I found a doctor dentist within the same week. And then I called and then I did it and I got one out at a time. And the first one that came out was really large. They had to put an onlay in my tooth. So, and that one took a long time to come out. But the second one, I started not feeling well after that because he had said something when he was taking it out. And I think there was a piece that flew and I ended up swallowing it because he looked a little nervous and I got sick. I had a really bad flare for probably a month after. And then I started taking LDN or low dose naltrexone, if nobody knows what that is, if they're listening.
Yeah, we'll come back and talk about that too.
Yeah, I feel a lot better now. But the first one that came out, no problems. The second one, that's when I started not feeling so great. And yeah, but I mean, I feel fine now, thankfully.
Okay, so we have the jewelry, we have the mercury amalgam, we have the nose ring, which is also jewelry. As for big stressors, is there anything big or is that kind of the high level overview? And then I want to go back and break those down.
I had surgery in 2017 because I had appendicitis, which they say is pretty uncommon when you're in your mid to late 20s to have that happen. So it was really strange. And I went for the surgery. I'm not sure if they left any metal in. I had some theories about that. I also thought too, I'm not sure if this is incorrect, so correct me if I'm wrong. With IUDs, I thought there is a metal component in it, which is interesting because my body pushed it out because I have adenomyosis, which is basically an inflammatory issue. Yeah. Reproductive issue. And initially when they were trying to treat that, they had given me an IUD, which helped for about 2 months. And I ended up growing some very large potato-sized cysts inside and outside of my ovaries. And then my body actually expelled it. It pushed itself out. And then one day I was like, I can feel something. This is weird. And I go and they were like, your body is pushing it out. We have to take it out. And fast forward a couple years to this past summer, I was supposed to do an excision surgery, but I'm a little weary of surgeries because with stress and trauma on the body and I don't want to. And the doctor I have now was trying to convince me. She was like, it's basically a fluke that it pushed itself out. That doesn't happen. Your body didn't push it out. And I was like, my body literally pushed it out to the point where I could just take it out. But obviously I went and had a doctor do that. But
this is actually a really cool story. So you touched on all the things, and I haven't had anybody on that was allergic to their IUD yet, but it happens all the time. Our bodies are so intelligent, and it is beyond my level of comprehension that doctors cannot see the connection there when it's so blatantly obvious. The good ones are great, but 50% of doctors graduated in the bottom half of their class. That is a thing. For real. Okay, let's go back and break it down. So I want to take you way back to, you said you were 7 when you had the mercury fillings put in. Now, is this before or after you started reacting to earrings? Were you reacting to earrings prior to the implantation of the amalgams?
It's kind of hard to remember. I don't think I got my ears pierced until it was, I want to say around the same time that I got those fillings put in. I was a
Okay.
little bit older. I wasn't like a baby.
Okay.
It was older than me being in first grade.
Okay. So I forget if you talked about it, but what were the reactions to the earrings and how was that initially interpreted? I think you said in your email to me that your mom just said, oh, you're allergic to cheap jewelry, but it wound up going beyond that.
So even if I put in nice jewelry, expensive metal in my ear, it's an immediate, like hot. It's burning hot to the touch, and then it's an immediate itchiness and it'll start swelling. If I put one in now, the whole ear would just turn red.
We could do that live on camera. Let's watch Emily's ears rot.
I could go get an earring. I have some in a box.
If it really happens that fast, that would be amazing. Although I don't want to do anything that would upset your equilibrium. We wouldn't leave it in, obviously, for more than like a minute, but wow, that could be cool. Okay, so we did decide that Emily's going to stick an earring in and we're going to see if her ear turns all kinds of colors.
Oh, it really doesn't want to go in. Come on.
That's how little she wears jewelry, y'all. Okay,
Can you see my ear?
I can see your ear.
You see it getting red? Hot already.
Is it?
Yep.
Okay, just leave it there. Leave it there. Okay, yep, I can see your cheek flush.
Yeah, I can feel it. It's like hot. Happens pretty instantaneously.
Well, thank you for being a live experiment on the Heavily Metal podcast. That's pretty interesting. Yeah, look at me for a minute because it almost looks like the one side of your cheek. Look at me straight on. No, I can't tell this way. Turn around again. Oh, yeah. It's very pink. That may not prove it to anybody other than us, which we already knew anyway. But
it's itchy, though.
Yeah.
That's the thing is I can feel the itchiness on the inside of my skin.
Oh, no. We just made poor Emily flare. Sorry, Emily.
No, it's okay. It'll go away in a little bit.
Thanks for donating your ear to the cause.
Anything for the cause.
Do you remember if those reactions were localized, systemic, or were you too young to know?
I think I was too young to notice. I feel like I wasn't really in tune with my body until probably the last 4 to 5 years.
Well,
realistically.
Join the club. I mean, who's in tune with their body at 7? Really? That would be a really genius, smart kid. Okay, so at the age of 7, you said you had a molar filled with the amalgam. How many teeth was it total? Forget the baby teeth that fell out. I'm talking adult teeth here.
It was just the 2 top adult teeth. And then they say it's safe if you don't have bruxism, you're not grinding your teeth, you're not doing any of that. But unfortunately, I was one of those people where I ground my teeth all the time. I ground down all the dentin on the top of my teeth. So I had actually cracked this one through the middle. So every time I was chewing, I would get this weird taste in my mouth and I could feel the crack because it was so deep. And there was all this bacteria. And they said there was probably stuff leaking from the filling into my mouth every time I was eating.
Oh, that's scary. I don't know if you've seen this, but I saw recently on social media, there was a video where Dr. Oz was like brushing. Did you see that one? So just for the listeners who don't know, Dr. Oz does this video where he's got, I don't remember if it was a dentist or who it was, but somebody there, and they were talking about mercury fillings and brushing the teeth. And they were actually able to measure the mercury vapor just from brushing the teeth. And it was 200 times the highest safe amount or something. It was ridiculously high just from teeth brushing. So I can't even imagine if you had that in your mouth and you have this crack and you swallowing a piece of it. It gives me agita to even think about it. Did you go to a mercury safe removal dentist, like a holistic dentist, to have those removed? So they used the big...
Yeah, he actually was recommended to me by my naturopath who also had mercury poisoning, which started him on his journey to being a naturopath because he was in college, I think, to do something else. And then he was having all these problems and they said, oh, you have a thyroid issue, you have this, you have that. And he found out actually it was mercury poisoning. And he went to the dentist and he got his fillings removed. He was fine after that. He had to do some chelation therapy and change his diet and do a couple other things. But all those other issues went away.
I don't know if you saw, the last episode was a dental episode that I did with a dentist who was poisoned by the mercury fillings that she was putting in. She didn't have her own. But
oh, wow.
And for those, I've even talked to one of my builders, had a mercury issue and just had to go have him removed. And he didn't know that, guys, if you're having mercury removed, you need to go to a safe mercury removal dentist. They're holistic dentists. They're usually members of the IAOMT. You can look that up. But
Okay.
yes, go to a dentist that is trained on safe removal of mercury fillings. They have to come in this big old suit. There's a big old vacuum. Even the smallest particles of mercury are super, super toxic. And it's funny, you mentioned he had this thyroid issue. You have this thyroid issue. It is definitely a known fact that people with metal toxicity and metal hypersensitivity, first symptom to show up usually is autoimmune wise, the thyroid. So if you have autoimmune thyroid disease and you've ever had metal sensitivity, bark up that tree. That's the right tree to bark up because it is a massive cause. And I think you said in your email to me that after you had the fillings removed, your thyroid level stabilized. Yes, not quite so
Yes, they did.
crazy.
I still take medication, but I could send you the picture for 4 years. Boop, 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 boop. Every few months, I would call my doctor, my endocrinologist, and I would say, I don't feel good. He eventually learned to listen to me, but at first, he's like, that's not possible for it to go that quickly. And it would,
Don't you
like, my
love living
TSH.
in the realm of that's not possible? I mean, we just
I
break the
know.
mold,
And
don't we?
seriously. And I mean, it was crazy. Like, I would have a very, very low TSH, and then all of a sudden it would be like 7.7. He'd be like, how did that do that in a month and a half? And I'm like,
Well,
I
and
don't know.
Hashimoto's, you can go from hyper to hypo, and it is that roller coaster. But we see with metal hypersensitivity, it's even more so in things that are really strange that happen with the thyroid. This is something I've never talked about on the podcast, but for me, of course, I have Hashimoto's because I have metal hypersensitivity. And they actually took my thyroid out because it was the size of my hand. It's supposed to be the size of your thumb. It was the size of my hand, and it was just
That's
swollen and
crazy.
inflamed and nasty. But when I had a hysterectomy, and I didn't have any metal with that hysterectomy or anything, but something about the way that the metal was responding in my body made my estrogen hormone replacement kept me from absorbing my thyroid hormone. And it is a known interaction, but not to that extreme. Like for people with thyroid problems, you'll know this, but I was walking around with TSH of 125 for 6 months.
That's just,
Yeah, I mean, it should be
yeah,
zero point 0.4 to 4.
could have been
That's
in
the
a
range.
coma with that
Yeah.
high.
So I was walking around with TSH of 125, but here's the crazy thing. So normally a normal dose of like thyroid medicine would be like 80 to 100 micrograms. I was on 250 micrograms of T4, which is the inactive thyroid hormone, and 40 micrograms of T3, which is the active thyroid hormone. And it was
Really
all
potent
getting into
one.
my body, but not into my system. You can imagine how I felt. And of course, the endocrinologist at
Awful.
UT Southwestern, biggest medical school in the area, has never seen anything like it. Sure enough, I come off the hormones and levels off, and now I don't take any hormones. So that's no fun. But crazy thyroid things with metal hypersensitivity that's just never before seen footage. Really, really weird. Okay. Did you have any systemic symptoms that you know of from the mercury fillings? If so, what were they? And you may not have even noticed that you had systemic symptoms until you took them out. What did you find out surrounding all of that?
Things I noticed before they came out is, especially on this side of my mouth, the skin around that whole area was peeling off in chunks and it was bleeding all the time. I could taste it when I woke up. It tasted like blood or it tasted like metal.
Oh, wow. Neither
Um,
one is
because
pleasant. Had both.
yeah, I was grinding my teeth so bad I could feel like little pieces. It was gritty. And all my sinus cavities, they were always really painful. I'm not sure if it's 100% related. I have trigeminal neuralgia, which now that I take the LDN, I don't feel it. So I'm not sure if it went away because I got the mercury fillings out or I can't feel it because of the LDN. I know that even before I started the LDN, my migraines and those nerve flare ups, they got a
Hmm.
lot less worse. I have a lot of GI issues. My celiac disease is very controlled, but I also have lymphocytic colitis. I had intestinal overgrowth, other issues. And a lot of that actually got better. I used to have full body rashes, autoimmune dermatographis. I can't remember the name of it, but it's like if you just scratch the skin, you'll get hives.
Huh.
That doesn't really happen to me anymore. After eating food, I used to get a lot of rashes and hives, and I would think, oh, I must be allergic to the food. I'm assuming it was probably from the fillings in my mouth.
How much have you delved into the low nickel diet at all yet?
When I had looked at it, Some of the stuff were things that I already don't eat. Like I can't eat any grains without having a horrible reaction. I end up with lower GI bleeds. I have headaches. I'm throwing up. I'm nauseous. I think chocolate, if I'm remembering correctly, which I
Yeah.
was not too keen on not eating. Although it's odd because I never ate chocolate growing up at all.
I don't know if you've ever heard, they say the body craves what we're allergic to, which is really interesting.
That is really interesting.
You don't actively, right now at least, adhere to a strict low nickel diet.
It's hard because I am looking into a possible mold thing. So I don't want to make my diet in such a small window because I do know nutritionally that can cause a lot of complications.
Have you seen my episode on the low nickel diet cookbook with Laura? Have you seen
I
that
haven't,
episode
no.
yet? Okay, you're going to love
I'm
this
gonna have to
because
watch.
Laura
Yeah.
is a med school resident and
Oh wow.
her degree is in dermatology, but she's also certified as a nutritionalist. She is super allergic to nickel, and she put out this wonderful low nickel diet cookbook that takes all
Okay.
those things you were just talking about into consideration. Her cookbook's probably perfect for you. Back to the teeth. Sounds like a lot of systemic symptoms there. Did you ever have a blood or patch test for your metal hypersensitivity? And if not, is that something you're considering for the future?
I haven't, but I did look at a few doctors. My rheumatologist, actually, her office is a asthma and allergy rheumatology center, and her husband is
Okay.
actually the allergist, and they do patch testing. So I was going to ask her when I saw her in a few weeks to
So
see if I could
let
get a
me
referral.
bring this to you and also to the podcast listeners because I get asked a lot about that. And I did two different episodes on testing with Melisa, and then I did two episodes with orthopedic analysis. I did a full interview with all of the heads of those companies, and we discussed everything about testing, about the blood metal LTT testing, which is not
Mhm.
FDA approved, but is clinically validated. And for systemic metal allergies is the most reliable. Melisa
Okay.
tests for more metals. Orthopedic analysis tests for a wide variety of metals, and they offer like blood ion testing, which in your case might be very beneficial to find out what ions might be circulating in your blood and where your levels are with those. I've only had the blood LTT test. I've never, thankfully, had a patch test. I hear they're very, very uncomfortable. But they both
Mm,
said that the patch test is not a good measure of what happens internally. It's very rarely has a positive titanium test or positive
mm,
titanium result. It can also sensitize the body further to metals because they tape them on you and they leave them on for a number of weeks or months. Now, the sad thing is that most allergists and most immunologists aren't even aware of the lymphocyte transformation testing or how valuable it is and the pros and cons of that versus the past patch testing. So for you and anybody else, definitely before you decide on a test, you may have one, the other, or both. Definitely check out those episodes. My
yeah.
plan is to have an allergist on here soon and we'll discuss that. And I've got a really great allergist and she's very friendly to the low nickel diet, to nickel sensitivity. She does patch testing. And I'd love that perspective as well, because I'm sure there is one. But I tend to lean more heavily toward the blood testing because it's not uncomfortable and it won't pre-sensitize to metal. So something definitely to keep in mind, but it would be very, very interesting to see what exactly you're allergic to. I bet there's going to be some surprises there.
Probably.
And how
Definitely.
off the scale. Like I just literally saw somebody that got, I think it was a Melisa test. And normally you see like everything's down here and the nickel's like here. Hers, like everything's down here and the nickel's like here. I was like, I have never seen a
That's
blood test that
crazy.
positive for nickel in my whole life, ever. Craziest thing you've ever seen. So let's talk about your nose piercing. Just to help me with the timeline, did you have your mercury removed after you removed your nose piercing or before?
I removed the first filling in October of this past year. The second one was in November. And then shortly after that, I took out the nose piercing. I feel like it
Okay.
might have been in January or February of this year.
Okay.
I started the LDN in December.
Of last year?
Yes.
And was that
Or
before or
November
after your nose ring came out?
before the nose ring.
Okay. So we'll come back to LDN because I want to talk more about that. But so your nose ring you took out, you emailed me. This is a separate email from you, but you took it out for a procedure and you hadn't planned to leave it out. But I think if I remember right, you took it out and you left it out by mistake. And then you noticed all of these symptoms clear. We know when you got it pierced and you got it Did you notice symptoms onset right after you had it, or were you just think it was life happening?
It was kind of hard to tell. I knew there was going to be pain because you pierce something on your face or your body, or you get a tattoo, or I have no tattoos, thankfully, which somehow I think I just intuitively knew. I was like, I'm going to be allergic to it. I'm just not getting one.
Yeah, smart move. Black ink and blue ink is super high in nickel.
Yeah. I always had pain in my face for a long time, and I just thought it had to do with having the scleroderma because there's a lot of weird symptoms and side effects and just strange things that can happen with that disease.
And for those who don't know what trigeminal neuralgia is, it's pain in the nerves in your face. They often say it's like suicidal pain. A lot of people that have it, it's
that's what
very,
they call
very
it. They call
pain.
it the suicide disease. It drives you crazy. I feel like there would be no amount of ibuprofen or anything. And anybody who does have it, which obviously always ask your doctor, but I found the best thing for me was taking 400 milligrams of magnesium and taking a fish oil or an omega-3. It can't be an omega-6 because it's inflammatory, but the omega-3 one works almost just as well as ibuprofen, if not better. But obviously ask your doctor.
Good things to think about. Yes. So you have your nose ring put in, you've had this face stuff going on for a while, you've had the facial rashes. So you take it out for a surgical procedure, you forget to put it back in. Tell us what you noticed and when it happened.
I noticed that the rash that looked like I had either rosacea or something else. I woke up one day and I was like, oh, that's weird. My face isn't all lumpy because I'm just going to take my glasses off just to make it easier. So this area right here, it was all raised and red and swollen all the time. No matter what I did, even if I put makeup on, it wouldn't go away. It was there and it hurt and it looked angry. It looked like a bunch of tiny little lumps, and the consistency of my skin was different than the rest of my skin. I also noticed too, I always had this nerve pain in my nose that wasn't there anymore. I can touch it now and it doesn't bother me. Before, if I just brushed it, it was like excruciating pain just radiating in my face.
And now it doesn't bother you at all. Do you feel any pain when you touch your nose?
I couldn't smell anything either. And the other thing that's really interesting now that I'm realizing it, I used to be able to smell fine. At some point, I couldn't, not really sure what that's from. I don't know if it's from the nose ring specifically, but I couldn't smell for a while. I went to an ENT and they take like a tube with the balloon and shove it in your nose. They couldn't even get it on this side, which is where I had the piercing. When they tried to show me the photograph on the camera and they were trying to put the tube, they were shoving it so far up my nose, trying to get it in like with such force that it was so painful. And then they're like, there's no spacing. Like it was so inflamed on that side of my face.
Wow.
And now I can breathe through my nose.
Sounds like a lot of tissue proliferation. Like it was just building scar tissue around the injury or the insult. Have you heard about Asia syndrome yet?
I looked into that because I've heard that there's metals in vaccines. I came to learn about Asia syndrome because, and I'm not telling anybody what to do as far as if they should get vaccinated, what kinds of vaccines. I'm just going to say what I noticed about my own body and what is clinically on paper and other doctors have agreed. So I'm just going to say that. After I got a tetanus booster because I accidentally touched a rusty nail and cut myself, which was stupid. And then I got all 3 of my COVID shots, which I had to for school because I wanted to register for classes. And that was that. Every time within a 1-week span, I had a spike in my TSH and I ended up with a case of thyroiditis and had to take steroids every single time. My cardiologist and my other doctors agree I'm not allowed to get a vaccine of any kind for the foreseeable future because I seem to have a reaction every time, which used to not happen. And now it does.
Well, there are metals in vaccines, and it's not about efficacy of vaccines. That's personal choice. But if you have an allergy to a vaccine ingredient, in this case, metal, then that would be a contraindication for receiving a vaccine. And people with metal allergies are very, very sensitive. I had a spine surgery guest, mainly was tipped off to his metal allergy from having repeated inoculations. And boy, his story, he went down pretty hard. That's not something that I do anymore either. But very, very interesting. And the thing that surprises me, it doesn't surprise me about your story, but I wish we were all more in tune with our body because you say you just intuitively know. Yeah, our body knows. Everything has frequency and everything has energy. And we can tell when we bring something close to us that the energy is bad or the frequency is bad with it. And if we can just learn to hone that skill and pay attention to us, it'd probably save us a lot of grief. But yeah, very, very interesting that obviously you don't talk to your doctor, but I wouldn't be surprised if the naltrexone has nothing to do with your trigeminal neuralgia or some of the pain you were having in your face. I'm a big fan of LDN. I take it myself, but I would tend to believe that it was probably the metal you had taken out of your mouth and out of your nose, and it's probably resolved all of it. That would be my bet if I was a betting person. At any rate, we're glad you're not feeling that anymore because that is definitely not pleasant. And
Excruciating. Yeah.
I bet you were so relieved to just figure out that you weren't going to have to live with that pain the rest of your life.
Yeah. I wonder sometimes even too, because I hadn't worn glasses for a while and the last pair I had was plastic. These are actually made out of metal. I don't know if it's just from the pressure of it being on my head, but once I started wearing them, because part of it is touching my face down here, my headaches started coming back, which makes me wonder if I should just buy another pair of plastic frames. But I spent a lot of money on these ones.
I say
and
yes.
I can't. Yeah, it's a pretty big sign.
You're more sensitive than I am. I think if I were you, I'd never let metal touch my body again.
Probably not. No.
That's just my personal opinion, but there you go. Okay, so you brought up an interesting one. It's been hotly contested by people who don't follow me. It's actually the subject of my first viral post that went to like 2 million people. You said that you have symptoms or don't have symptoms when you do or do not drink out of stainless steel water bottles. Tell me about that.
So one of the comparable things that I could say is when we go camping, and it's not the same, obviously, we use plastic, which I hate. Plastic also irritates my throat. I noticed over time, because I hadn't ever had like a portable water bottle, when I had started going back to school in 2022, and I was walking around on campus, I bought a stainless steel water bottle, and I started noticing the same way when I drink out of any type of plastic bottle, my throat hurts when I drink out of stainless steel. And it took me a little while to realize. And then I think I actually realized it when I was listening to your podcast. And I was like, I'm probably allergic to the stainless steel water bottle. And then I kept drinking out of it. And then I wouldn't drink out of it. Then I'd drink out a glass in the morning. And then I would let the water sit in there all night. And then I'd take a sip of it in the morning and I'd wait a little while. And I'm like, my throat hurts. And it would just. And then I finally bought a glass one and was like, I'm just not going to drink out of it. The only thing that is, I would say, difficult to get metal, I would say, fully out of my life is cookware. We do have stainless steel pans, which I find that the food doesn't really bother me when I use those. But we were using some kind of green pan before, which I'm not sure what that's made out of, to be honest.
I have a set of green pans. That's my cookware of choice, actually. So my green pan is a ceramic lined cookware. The nonstick is made from sand. Should be completely safe.
We had those, but we had ruined them. And my in-laws bought us a whole set of these beautiful, gorgeous stainless steel pans. And I started using them. And now that I'm thinking about it, they came around Christmas time and I hadn't been feeling well. So now I'm thinking, I'm like,
yeah, cookware's a thing. Cookware's a thing.
Yeah.
Yep. You might sell those and buy you a nice new set of green pan.
My husband can use those because he seems to be fine. He doesn't.
Yeah. So for those just tuning in that don't know, the safe cookwares would be glass, cast iron, anything that's 18-0 stainless. If it's 1810, the 10 is nickel content. 18-0 is typically okay, but stainless steel is an alloy. It's usually alloyed with nickel. Many are allergic to nickel. That doesn't mean you're not allergic to some of the other alloys. Same with cutlery, same with silverware. I actually know a lot of people in the low nickel diet lifestyle group that carry plastic or like wheat straw silverware. Wheat straw is awesome. It's like a hard, non-toxic, microwave proof, BPA proof plastic. So I went to a Renaissance fair this weekend and found the coolest thing to drink out. This is what I normally drink out of. For anybody who wonders, it's silicone and glass, big old bottle from Amazon. That's what I drink out of. Yeah, go girl. But I have broken a few of them. I went to the Renaissance Festival this weekend and I saw the coolest thing just as I was getting ready to leave. And it was like, I want that. So check this out. This is a gourd. Okay. It's a big old
gourd. I love
gourd.
that.
And I love it too. I asked her what's the inside out of, and it's cured with beeswax. And I'm like,
oh, that's cool.
No way. It's totally safe. But here's
safe.
the thing. How do you drink out of that? I paid like $60 for this. I'll put the link in the show notes if y'all want it, but I think it might be better to pour into a cup if you're at the Ren Fest and you have your big old mug or something. Cause I can't see that a lot of this would make it into my mouth if I just try to drink out of it. It's super adorable and I love the idea. I'm not sure how to get it into my mouth from here. So I might have to carry around a
Yeah.
mug and wear Renaissance garb all the time to use this effectively, but it's very cool. I don't love plastic. I'd love something that didn't break. Ceramic lined is also safe. And I think there were a few water bottles in the group that are discussed. They're coming out with better options all the time. And we need those because I'm not a fan of plastic either. But it really does make a massive difference for people. It's amazing the people in the group with dyshydrotic eczema that touch a door handle and they break out in this huge eczema rash for a week just from touching a door handle.
I also have eczema on my hands, which is funny because now I look at my door handles and I'm like, I'm like, oh no, it's me.
And now a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with MELISA testing. MELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. MELISA, a valuable diagnostic tool in medicine. Let's talk about your appendix. For those who don't know, most of the time when an appendix is removed, not all of the time, doctors can leave a small surgical clip at the side of the amputation. Have you explored this? You already said you have GI symptoms. My bet is they did leave a clip, and my bet is that's possibly quite a few of your GI symptoms. Have you explored that at all?
No, I feel like they won't remember, and I'm not going to say the doctor's name. I don't know if I would contact them because when I went back for my follow-up, they had given me 40 painkillers for an appendix surgery, which I feel like is a little excessive.
That's a little excessive,
I don't know.
Yeah.
When I went back, she asked me if I wanted a refill on my script. And then in the moment, I knew you're not the kind of doctor for me, even though she's a surgeon and it told me all I needed to know. I said, no, I'm all set. Thank you. And she was like, are you sure? And it's like that in of itself, especially.
Oh, that's creepy. Yeah. I've
been
through almost every surgery, including major spine surgery on ibuprofen and Tylenol. Guys, it can be done. And I'm a wimp.
Yeah.
So yeah, that's pretty excessive. Well, you can find out just with an x-ray, right? It'll show up on an x-ray.
Oh, that's true too. Although, would it show up on anything else?
It would show up on a CT scan if it was done without contrast, but you'd have to go look for it because if it's done with contrast, the contrast material lights up the same color as the clip.
Yeah, I've had some CT scans without contrast. Yeah, I think I have the report so I could just look at it.
You carry that into a general surgeon, say, would you please look and find out? You can look at your op report as well. If you didn't have your op report would say if they left a clip. Most of the time, not all of the time. There's been times it doesn't, but if not, you could take the CT without contrast in and have them look for it, but they're going to think you're cuckoo for Cocoa Puffs because clips are pure titanium and they don't cause allergies and they don't cause systemic issues. Obviously, from watching my podcast, I know people that almost died from 3 little gallbladder clips or even the smallest micro clip that's the size of a staple. So yes, it can cause all that. And then it's getting the surgeon who's willing to go out and remove that clip. They'll tell you, oh, you're going to die or it can't happen. No, it does happen and it can happen and you're not going to die. We had a surgeon on who removes clips and staples, abdominal clips and from appendectomies and bariatric surgeries and all kinds of things. I'm not sure he's doing that right now. There was a lot of pushback from some people, which, this is a very new area. It's just a new thought that people are experiencing symptoms from having these small clips and staples, but the evidence is just building and building. By the time you remove these, my season 2 opener guest had three clips in her neck and was diagnosed with cancer. The minute they removed the clips, it goes away. She was diagnosed with melanoma. They were going to do facial flap reconstruction surgery, like reconstruct her entire face. And it was a allergy to 3 metal clips in her neck.
Yeah, that's wild.
Yeah. Some of the episodes, guys, if you're not listening to them, I put my best stuff in there. Go listen to them because it's all the stuff you need to watch out for and all the stuff you need to know. You have other diagnoses, which we'll talk about in a minute, but I would be shocked if most of those don't stem from metal in your environment or metal in your diet with the way your body reacts. The evidence almost seems overwhelming to me. I can spot a metal allergy patient a mile away. And it's so funny. My brothers laugh at me. They're like, you think everybody has a metal allergy? I'm like, well, a lot of them do. When you go down this list of foods and yeah, I can eat those, and go down this list of foods and yeah, and I can't eat those. And then you tell me you've reacted to earrings. I'm like, you got a lot of homework.
Yeah. I do also think it's interesting, and I apologize if this was in a podcast that you talked about and I missed it, or in something that you said. And I don't think I had put it in the email, but I remember for a really long time, my mom kept telling me our whole family has either one or two copies of MTHFR, and I have two,
Yes.
and we all react to metals and scents horribly. I can't be in the same room if somebody's using Fabuloso. I can't even be in the same building. She would always say, you got to get checked because you detox things poorly. It would make me wonder how many people who have metal allergies also have that.
Probably quite a few. My gut feeling is that
Mm,
MTHFR certainly makes a difficult situation harder. I have one copy
yeah.
of C677T, so I'm not quite as affected as many. What's interesting, once you calm the metal burden in the diet and the environment and inside the body, a lot of the smell sensitivity, like a lot of the overreactivity of the immune system goes away. So to me,
Mm,
if somebody is sensitive to metals and they have a hyperactive immune system and they haven't calmed down the inside of the body, the diet, the environment, I think they're going to continue to be reactive and much less so once all that is removed. That's doctrine of Sherry here, again, talk to your doctor, but that's just from my own experience. That's what happens. And for the stuff that's left, I talked about this a little bit on my last episode with the Better Health guy. Limbic system retraining, which is retraining the brain out of chronic fight or flight and chronic illness, is probably as big of a Hail Mary pass as just like LDN or taking the metal out. It's equally as important because our brain programs our body. It's not like we're
mm,
making the symptoms up, but there's something in the way our brain is actually programmed. The way we speak about our illness, the way we speak about symptoms, the way we say we recover. Oh, I'm immune compromised. If we change our language, it changes DNA and it changes our body's response. It's the craziest thing. Wheelchair to rollerblades.com. Go look at her story. She had 35 specialists, chronic infections, Lyme disease. I don't know if she's allergic to metals or not, but she was not getting better. She was literally dying and only did this brain retraining program and is completely well today. No pain, no disease, no nothing. And that's all
wow.
she did. And I hear that story over and over again. So there's all kinds of things that the Better Health guy and I talked about that we can do, like low dose immunotherapy or NAET, which is a modality. I don't even know enough about it, but it basically reprograms the body so that even though the allergen is present or the scent or whatever X thing is, the body doesn't notice it. And it's a really
Mm,
cool, like unpacking. And I think we're just starting to really realize how powerful our brains are in those kind of capacities. I think you've got as
yeah.
much of the journey ahead of you as you do behind you. And I'm excited to see where that all takes you because I think you've uncovered a lot in a very small amount of time. Will be a really interesting thing for you, I'm pretty sure. As painful as that might be. You said the chronic conditions that you've told me you were diagnosed with. So celiac disease, which I'm going to add a side note here. We thought I had celiac disease. I was gluten-free for 10 years and I had the testing that said I was, but it turns out I'm one of those crazy people that I added gluten back in when I got my nickel diagnosis because the gluten-free grains are the grains that are the highest in nickel content. As long as I do white bread, white rice, white flour, I have zero issues. So that would be interesting to me is, are you truly celiac or are you allergic to the wheat and the nickel containing grains that are like super, super high? So, something to maybe think about, but like fibromyalgia, that's one we hear all the time with metal hypersensitivity. Lymphocytic colitis. It wouldn't be the first time I've heard of metal allergies affecting the lymph nodes. Like the gal I had, Maria, that was my season opener with the neck clips. That was her like primary symptom was her lymph nodes were like super, super swollen. I don't know enough about that particular diagnosis to really weigh in, but like Hashimoto's for sure, super common. Scleroderma, don't know enough about that, but myositis, I would think.
Scleroderma overlap with myositis. What's interesting about that is even though like I just got diagnosed last week, it was the first time anybody ran a panel for it, but I've had the same symptoms since I was diagnosed with fibromyalgia when I was in like 2010, I think it was.
Mm-hmm.
So it's like for this entire time I could have had it and just not known it. I just know that over time, I've been feeling better than I would say worse. I had a little bit of a flare up there over the winter time, which I think had to do with that whole thing.
Yeah.
Eating a piece of it that I shouldn't have eaten and him having like a oh shit moment,
Yeah.
which I'm sure it was an accident. There was a vacuum. It was a fluke thing, but I'm fine now.
The
No
human
felt.
body is designed to heal and it is resilient
Yeah.
and you can heal from even that. I feel like the fact that you are getting better instead of worse and you're taking out more and more metal, I just wouldn't be surprised if someday you write me and tell me it's all gone.
I would love that because I would say the outlook for the myositis and the scleroderma is not a great one. I don't want to sugarcoat it. If anybody's listening who does have those things, I feel for you. It's hard too, because I do wonder if, especially with all the things, I can't really say I've read a lot about metal allergies, but what I've listened to you say and anything I've heard in the podcast and anything I have read, I feel like it just pisses the body off. And I wonder how many people, whether it's mold or metal or both, that have these things that they're dying, because a lot of my friends are dying. I feel very lucky and I'm grateful that I'm not progressing in the same way. But it is interesting because as I do take more metal out, I feel better. The more that I go rock climbing, the more that I change my diet to take out things that were irritating me, and the more that I focus on my gut, it's like the better I do feel. I don't want to say that you can fix everything, but I wish more people would take accountability for their health because I think they have more power than they think they do. It's like they get a diagnosis and they think they're dying, and it's like you don't have to.
100%. There are people that I know in my life that I know have metal hypersensitivity because of what they've told me, that have bodies full of metal, something as simple as a permanent retainer behind their teeth. People that I'm like, hey, I hear regularly from listeners and followers that they remove these metals out of their body and their fibromyalgia that they've had for 10 years goes away. And you know what they do about it? Nothing. I don't know if it's just some people want to be sick. It just takes too much energy. I'm sure there are those people that get high off being sick or like the extra attention, but that's not me. There are people out there. I think this message is so important. That's why I'm screaming so loud, because people are dying. People are committing suicide, and it's stuff that is preventable. There's an email that I saved called Plasticity for Pain, and it basically is about reprogramming the brain to not see pain. This is a guy that had chronic pain his whole life, like 14 years, and opened a pain management clinic where people go to die with their chronic pain. All these people that have this problem or that problem or need this surgical procedure and can't have it, therefore they have all this pain. And he was able to rid all of them of 100% of their pain just by the exercises that retrained the brain. So it's taking the metals out. It's going rock climbing and doing the things that bring those positive endorphins. It's not speaking about your illness, my autoimmune diagnosis or my this or my gluten sensitivity. Don't own that for yourself. You speak differently about it. It changes your DNA. It changes your body.
100%.
And I really do predict, and you can say you heard it first on the Heavily Metal podcast, that someday you're going to come back and say it's all gone. I think, do you have scleroderma? Do you have fibromyalgia? Do you have the myositis? Just my opinion would be that you have metal allergies presenting as those things. And once the metal is addressed, most of that goes away. That would be my bet.
I hope so, because I don't want any of it.
But it's a process of even unraveling, because I've had now 40 surgeries and 7 to remove metal. I had, I don't know, 3 or 4 of those surgeries to remove metal before I even found out that nickel in diet was a thing, and everything I was eating that was lighting me up. And so I took that out and just keep getting better and better. But it's just a process of unraveling all these little things you think cannot make that big a difference. Oh, this little piece of chocolate, it can make a massive difference. Now, I am lucky. I do get to eat chocolate, but I've also taken a lot of metal out of my body, and it does affect me when I eat it. It's like, how bad do I want to pay for it? But at least I can make some of those decisions now because I've cleaned up the rest. Sometimes I will go out and have a Caesar salad, or I'll have a high nickel meal. But the further you go down this track, the more you find a balance with what works. And so I'm excited about that for me and for you and for everybody that's listening. We said we would talk about the LDN, or the low dose naltrexone. And for anybody who doesn't know, it's a great immune system modulator, and it helps with pain. It's non-addictive. Yep. Sits on the opiate receptor sites. And it was super fringe about 10 years ago. It's becoming more and more common. How did you hear about LDN? And then how did you get it? And what has it done for you?
I heard about it in a lot of different autoimmune groups that I'm in, especially the scleroderma ones. Normally, that disease progresses very quickly. You get pulmonary hypertension, you get heart failure, your organs shut down. There's a lot of collagen buildup in your whole body. Everything becomes very tight. A lot of people get hand contractures, so they can't use their hands through the whole process. Over the last 5 years, I've been looking for anything and everything to slow it down and not make it happen because I'm not ready to die. I know I'm not saying anybody is, but I really am like, I have more to do. I have a lot of life to live and I'm not ready to just give into it. And it kept coming up, and I'm weird about medication. I don't like taking medication unless it's life or death. Like my thyroid medication is probably the only one that
Yeah.
I'm generally okay with. And I ended up going with Tirosint, which is, I don't know if that's one you've heard
I
of or
take Tirosint.
but
Yes.
yeah,
I love Tirosint.
super allergen friendly for us.
That's the med, y'all. That's the med.
Yeah. But yeah, I was so weird about even cold medicine because even if I would take Mucinex, I would have a weird reaction. And then I noticed, I was like, oh, there's metal in the Mucinex, like
Yeah,
aluminum.
there's titanium dioxide. So it's interesting. I wonder if you have a titanium allergy. Yeah. When you do get a metal test, you're going to have to report back.
Yeah, I will for sure. I'm planning on getting one, and I'll definitely let you know what it is because any medication that has aluminum, titanium, anything in it, it's like within like 15, 20 minutes and my face gets red, my whole body gets flushed. It's a great time. It's a party. Oh, back to the LDN. So it just kept coming up for a couple of years. And then after I got my mercury fillings out, and then that first one was fine, the second one wasn't. And then I had a bad flare. I asked my rheumatologist for it. I was like, you know what? I want to try this. I need it because my inflammatory markers are still really high in my body. It's mostly just my sed rate. Everything else is fine. But it kept creeping up. And it finally was around 50. And she was like, you have to take medication because we want to preserve your organs. And I was like, let me try the LDN. Let me see if it helps. And I took that. The inflammation since I started the LDN, it's come down a little bit, not as much as I want to. It's in the low 30s now. Obviously, it needs to be in the teens for it to be normal.
Well, I think if you get a certain appendix clip removed, that might be a good thing. If you change your cookware back, that might help. I can't wait.
I would say, and also too, tapering every time, super uncomfortable for me. I don't know if that happened for you. Every time I would taper up, I would flare. I know some people say that.
Why would you taper off? I've never tapered off.
Or taper up, like going from like 1.5 to 3 and then 3 to 4.5. So right now I'm on 4.5. But when that taper for that first few weeks is like hell. And then I want to say maybe like a month or two ago, I just woke up one day and was like, I feel great.
Yeah, it does take a few months to work. It's not something you take one day and you notice a difference. I don't notice any difference. I'm super sensitive to medication. Like I can't take most of it because I have severe side effects, but that's one that I can take. It has to be compounded, everybody, in a slow release form. But that's one that I can take and I have no noticeable side effect, except if I take it at night, I have really vivid dreams. So I take it in the daytime. I take it in the morning. That is one that I notice when I don't take it, I hurt a lot. I've had to taper off of it for surgery. So I don't take it like 48 hours prior. I still have a lot of metal in my body, which is why I hurt. I have metal that can't be removed. If I get 48 hours before surgery, I'm hurting a lot. You stop taking it so that the opiates they give you for surgery can work during the time you need to take it. But yeah, it's pretty much of a miracle drug and it really modulates the immune system and it has a lot of really great published literature and real great benefits. It's a shame that more doctors aren't aware of how cool it is for pain relief. But I'm glad to hear you're on it. I'm glad to hear it's made a difference. It can make a difference in potentiating thyroid meds, which means if you're on a certain dose of thyroid med and you're almost hyperthyroid, you up your naltrexone too quickly, it can make you hyperthyroid. So it's important to monitor thyroid levels when you start taking LDN. Don't just go to a doctor who knows nothing about LDN and say, hey, put me on this med. They've got to monitor thyroid levels and got to have somebody that can taper you up and tell you how to do that. Any other medications you take that are helpful or what has been your experience?
I take Chinese herbal medicine from my naturopath, and the base of it is Andrographis paniculata, which is a plant that has a ton of really great benefits. It's anti-inflammatory, anti-fibrotic. I had been on it the last few years, so for all I know, that might be the reason that I'm also removing some metal from my body. But in addition to that, might have helped me feel better too. I notice that when I do take it every day, I feel significantly better than when I don't take it. In
Is it a
additionally to the
mushroom?
LDN.
Like a medicinal mushroom? What is it? Do you
No,
know?
it's a plant. It has some interesting things. There's some research about it helping with MS. There's a study that came out within the last few months about it treating muscular dystrophy, which I thought was amazing too. It does have some very potent anti-inflammatory effects. I'm a
I'm
big
such
fan
a
of it.
fan of plant-based medicine and I love essential oils like all the things, but ever since the metal allergy diagnosis and figured that plants really light me up, I've steered clear of a lot of the plant-based things. I do try and
Mm,
rotate them in moderation, but I don't think I could take anything concentrated plant-based every day. We all have to find our own balance. I'm glad you found something that you love that makes you feel better. That leads into the next question I was going to ask. How have you adapted your lifestyle to cope with your metal hypersensitivity? We talked a little bit about you changing your water bottle. Doesn't sound like you've done a lot of other changes necessarily in your environment yet, but what have you done?
I don't wear any jewelry at all. I don't even wear my wedding band anymore. I would love to because it's beautiful, but I noticed when I wear it and when I had taken it off because I was wearing it for a long time, the skin still feels weird, but right here on the finger, there was a red angry ring around my whole finger. So I just don't wear
Mm.
anything, even in terms of like a sports bra. I don't wear stuff because I noticed too, like even like with metal wires, those things were always bothering me as well. I have a zipper on, obviously, on my hoodie, things like that, just stuff that's not going to directly touch my skin for prolonged periods of time. I try to stay away from those things. Cookware, obviously, I actually only just realized it while we were talking about it on here. The water bottle I had changed over. I can't remember exactly what was on the dietary list in terms of things.
It would be nuts and seeds and leafy green vegetables, brown rice, coconut's a big one. Coconut.
Yeah, that was the thing I was having. So I can't eat any land animals. Most of my diet consists of beans, nuts, and lentils because I have lower GI bleeds when I eat animal protein,
Do you have
except for
alpha gal?
fish. I don't think so because I can't even eat chicken without having a problem. And somebody asked me about that before too.
So let me throw this your way. I have alpha gal syndrome. I got bit by two nymph ticks about
Mm,
6 years ago, and 2 weeks after, couldn't handle any meat. And I'm a big meat eater. I could
mm.
handle chicken, but I have heard of about half the people with alpha gal can't. Can you do dairy?
No, I can't have any amount of dairy.
I'd be surprised if you didn't have alpha gal. And here's the crazy thing for me. So my immunoglobulins are low. So my alpha gal panel comes back negative, but it came on 2 weeks after the tick bite. I'm so sensitive
Mm.
to anything from a mammal. There are a handful of us that have both metal allergies and alpha gal. And it's really interesting to try to find
Interesting.
things to eat. Fortunately, it goes away after about 5 or 6 years for at least half the people. That's what the studies have found. And mine actually is going away. Finally, it's been 6 years and it's starting to calm down. I had a repeat alpha gal test a month ago and it was still negative. But my immunoglobulins are super low. I think they're like if a normal person's immunoglobulins are here and you have the test, it might put you up here, like over to where you get a positive result. But if they're under here and it just brings you up to here, it's all going to look normal. And I think that's exactly what's
Mm.
happening to me. I know it's not into my head because I've almost done a blind study, not by volunteering. When I have my medicines compounded, I get them in veggie caps. And sometimes they've made mistakes and put them in a regular cap that's a gel cap. Gelatin is animal sourced. And I literally would get super sick, like to the point where I couldn't even eat. And nothing else in my diet had changed. I call the pharmacy. I'm like, did you happen to change my capsule? And they go back and look at it. And oh, yes, we did. It's like a light switch with me.
Mm.
Alpha gal is a really interesting thing to look at. And this is something I wanted to touch on because we talked about you having celiac and autoimmune diseases and maybe a mold issue. But the last episode, if you haven't heard it, go listen because many with metal hypersensitivity, our immune system is so hyperreactive that it leaves us predisposed to other things like mold illness and chronic
Mm.
infections like Lyme disease and the co-infectors of Lyme disease because the type of allergy we have. It's delayed, right? It's a type 4 allergy. So that means our reactions are delayed, which is why you think like you have the cookware, but you don't think it's bothering you. Check out 4 to 6 hours down the road or the next day and see
Mm,
how you feel after cooking in that cookware. The interesting thing is because the allergy is antigen driven and T cell mediated, it has a different mechanism than like a contact allergy would. It basically compromises our immune system, and our immune system then becomes vulnerable to these parasites and pathogens, these bacteria like Lyme disease or Bartonella or Brucella or Babesia that
mm,
many people can carry until the immune system goes down. And then these infections that are chronic activate. Also viruses like EBV or the herpes virus, the HHV virus, and then the mold thing can become a big thing. So that's why I put
mm,
out that episode. And I'm sure people saw the title and like metal allergies and chronic infections. What? That's
mm.
why. I'd be interested to know how many of the severely metal hypersensitive community is running around with Lyme disease and chronic infections that have not been properly diagnosed yet. That was the whole purpose of our last episode. Do you go after the bugs or do you heal the immune system and let your immune system take care of the bugs, which is kind of where we wound up, where I actually treated my Lyme disease. It was very much part of my story. I went to a chiropractic clinic in Coeur d'Alene, Idaho, that's very famous for treating Lyme. They use muscle testing and energy balancing, no medicine, to basically
Huh.
call the immune system to where the virus and the bacteria is. And then the immune system over like a year gets rid of it on its own by itself. And it worked.
Oh, wow.
I don't have a single symptom left. But again, there's so much and it's so just, isn't it fascinating?
There's so many things I feel like in the human body that are happening. Yeah.
I
And
would
it's
go
amazing
back
what our
and live
bodies
my
can do.
horrific, horrible journey all over again because it led to this podcast and it led to me. I always call it a God thing or a higher power thing. It's like I get emails 3 times a week, like, you saved my life. It has nothing to do with me. It's the message that God enabled my journey to put out there that is saving lives. And very much like that, I think your journey will be the same thing. You're about to be a doctor, you're about to be a nutritionalist. And how many people are going to come to you with this thing that's never been solved? And you're going to have had all these experiences to bring to the table and you're going to save lives too. It takes a village. It's just
Hope
going to
so.
be one thing after another. When you go through things like you and I go through, you just want to pay it back. You have to pay
Yeah.
it back because you can't just go down the road and know that there's people dying and not pay it back. We're getting close to wrapping up, but you don't necessarily follow a low nickel diet at all, even a little, or are you still looking into that? What have you taken out? What have you not taken out? Of course, now you have the animal thing too, like I do.
I think when I had looked at it, I sort of pinned it like, okay, I'm going to come back to this. And then there was a lot of things that happened. And now I'm thinking about it again because I can't eat any grains at all. I've been taking those out, made all, like half of my symptoms better. And that was almost 2 years ago now. Recently, I want to say maybe 6 months ago, I started eating flowering grains like quinoa, anything that's more like a seed and not.
Quinoa is typically safe for most with mental
Yeah,
allergies.
that one
It's,
I have no problem. Like quinoa,
what about white rice?
amaranth, I can't eat any rice, white, brown, any of it.
You've tried it
Yeah.
recently? Interesting. Because most with metal allergies can tolerate white rice.
I don't know. It gives me a lot of achy joints and then lower GI bleed. It's
Interesting. Rice is really high in arsenic. I think they've done a study. The Lundberg organic white rice is not high in arsenic. So that's kind of what I try to stick to when I do rice. And there is an organic white rice protein powder that many with metal allergies are able to do just fine too. It's tricky. I don't think all white rice is created equal. What else are you able to eat? And I guess the thing is, if you're not actively adhering to it, you may not know now, but definitely people with metal hypersensitivity want to pay attention. If I eat beans, how do I feel in 6 hours? If I eat coconut, how do I feel in 6 hours? If I eat X high nickel food, how do I feel in 6 hours? Because 6 hours to the next day seems to be the barometer. And I know, at least for me,
Mm,
things I thought I was reacting to in the moment wasn't anything to do with the thing I was eating in the moment. It was the thing I ate 6 hours or the day before that was super high in
mm,
nickel. It starts to get really interesting to do these experiments. And I'm sure you'll feel it out as you go. You'll find the right thing, the
mm,
right combination of things that works for you. For me, I found a red meat I can eat that's poultry, emu and ostrich. I can eat it no problem. But my other friend with alpha gal can't do chicken or turkey. She can do some fish and she can do eggs. And thankfully I can do eggs. The
me
protein
too.
options seem to get pretty low. Can't do tofu.
Yeah.
Yeah.
Yeah, I can't eat any soy without getting violently sick.
And that's, again, the metal thing. My son had an allergy that we thought was soy, and it wound up, yes, to be soy, but it was metal that he wound up being allergic to. He's adopted, and he had been throwing up his whole life and allergy shots and the whole 9 yards. And we just found out after my nickel allergy was diagnosed. I'm like, hey, take these low nickel diet foods out. He has no metal in his body, except he had a scar from when he was blacksmithing that had healed and
Mm,
whatever. But then he came down with Lyme disease, and that scar opened up. Because as your
mm.
immune system is inflamed, things that are pre-sensitized like open. Anyway, I said, take the metal containing foods out of your diet. And he did. He's like, Mom, I'm not throwing up my food anymore. Looking ahead, what are your plans and hopes for managing your health in the future? And then are there any steps you're considering taking to further improve your well-being?
Well, one thing I definitely want to do is get a metal allergy blood test just so I can
Mm-hmm.
see where I'm at. I think I might also ask for a blood mercury level just to see
Mm-hmm.
where that's at because I feel like there might be some or a lot circulating.
Mm-hmm.
I noticed, especially right before I took them out, I was having a lot of issues eating things like tuna and salmon. I would get really sick when I would eat tuna, and then I stopped
Mm-hmm.
eating it because I know it's very high in mercury. I can eat it now, but only like once a month. That's all I let myself. I think some other things too is probably looking at that diet list again and that cookbook that you talked about earlier in the episode. Laura, what was her
Laura
name?
Duzette,
Laura Dizette.
thelownickeldiet.com is where you go for that.
I feel like also when you look at a list, it's hard to visualize, but if you see recipes and especially in a cookbook, it makes it a little bit easier to get started on it.
So
Um,
much easier. I will say, no offense, Laura, but some of the things she does use because she tries to pay attention to the microbiome and use a well-rounded nutritional approach in diet, which is great. We need that because we can pigeonhole ourselves into things that aren't
mhm,
as healthy for us. But like she uses coconut aminos. Some people can. I can't use coconut aminos at all. And she had a rationale for using that when people have asked her. I don't remember what she had said, but I actually did try it because I try to program my brain into healthier ways of acting. So I did bring it in and it actually made me super sick, but that's going to vary. I have a lot of metal in my body that other people don't. So my bucket's fuller. One of the things I did want to ask you, because you brought up the MTHFR, and if you think that there's a mercury toxicity problem, which metal toxicity is different than metal allergies, do you do anything to detox? And have you looked at that as part of your road to wellness yet? Or are you still just at a precursor level to that?
I'm at the I thought about it stage and
Yeah.
kind of planned it. I think the biggest thing I'm working on right now, or I have been for the last few months, is unrelated to all of this. It's more my mental health than anything. And
Nope, it's
that's
not
my biggest
unrelated.
focus. Well, related, yes, but we hadn't touched on it. Yes, definitely related. And that's the biggest thing is me getting through a lot of my PTSD that I have
Yeah.
and just
Well,
getting to a better place
yeah,
so that
we
I can
all have
handle
that,
all
and
those
that's
changes.
way amazing to do that. I will tell you that we did touch with the Better Health guy on the detox things. There's a lot of things that can be done for detox, but when you have a lot of either metal toxicity or metal still in the body, you have to be very careful. You have to go low and slow. Like hard chelation is pretty much a no-no because it can pull from the metals and
Heard that.
redistribute in the body and make things actually worse. So gentle methods, like for me, it was an infrared sauna, like sweating it out and then showering immediately,
Mm.
super helpful. But coffee enemas are helpful. TRS spray, a zeolite spray by Cosiva that can grab and encapsulate metals and issue them out of the body without redistribution can be a thing for some people. So there's a lot that you can look at. And I think the more and more you detox and look at binders and things that are healthy that won't pull or redistribute, I think you'll probably feel quite a bit better from that. The brain retraining, again, guys, I do show notes with these episodes, and on my list of resources on the website, if they're not in the show notes, there's links for the limbic retraining company. I'll have to put a link for the big old water bottle, the gourd water bottle people. I'm adding resources all the time. But yeah, that the mental health is so connected, and I'm so excited that you're actually doing that. And then there's other things when you've gotten as far as you can get, like me, there's metal I can't get out. There's practices like NAET, that's a modality that reprograms the body so it doesn't see the allergens. There's so much we can do, and you're still early on, and I'm relatively still early on myself, but that's going to be an exciting thing to go to. How have you updated your medical records, and how do you let medical providers know about your sensitivity? And then what has their response been?
I haven't really broached that per se. I had told a couple different physicians and specialists that I thought I was having issues with my mercury fillings, and most of them did this when I
Yeah.
would say something, and I just knew maybe this isn't the right person for me. Or they would say, I don't really think that's a thing, or I'm not really sure what you're talking about, or I don't really know anything. The only one who really listened to me, I would say, besides my naturopath, who told me to go see the specific dentist, was my rheumatologist. She said it could be something that might help. It also might make it worse if they don't do it correctly. She'd said that's a very personal choice for you to make. And if you feel that's right, then do it. And I think that was a really good way of her saying it. Like, even if she doesn't believe in it or go along with it, she said it in a way that didn't make me feel like she just dismissed it or I wasn't seen. So I appreciate that.
Right. Super, super important.
Yeah, I think maybe having a blood test and maybe being able to say, well, look at this,
And it's amazing many still don't even give value to that or credence to that. Have you updated your medical records? Do you have a medical power of attorney, and do you have a healthcare directives, and do you line that out? Do you wear any kind of an ID bracelet or anything?
No, the only thing I did ask was the last time when I was at the ER, I asked them if there was metal in the contrast dye, and they told me no, but I didn't feel good a few days after. So I have an odd feeling that there actually was, because they basically were like,
was it
don't worry about
gadolinium?
that. It was
Gadolinium goes by
something
several
with an
names. I think
I.
Omniscan, Omnipaque, maybe. I may be wrong. If it was a contrast with gadolinium and it was not iodine based, that is a metal.
It was iodine based.
Then usually you're okay. That may have been more
No.
of a detox issue, but yeah, gadolinium is a metal agent. So people that have metal hypersensitivity, it's amazing how they try to say, how they try to force it on you, and oh, the body eliminates it. No, the body doesn't eliminate it at all. And it is a metal. So that's one to stick on your radar if you have metal hypersensitivity. There's a great page on Facebook called Living with Gadolinium LLC. That's a great page to go for gadolinium resources. She is wise beyond her years with gadolinium for you or anybody that wants that information. Before we end, I do have to ask you what your favorite heavy metal band is and your favorite heavy metal song. That is a thing here on the Heavily Metaled podcast.
Oh no, I'm so bad at this game. I would say my favorite heavy metal band would be AC/DC, and my favorite song by them is Back in Black.
Love Back in Black. That was the first song I learned to play on a drum set, was Back
Oh
in
wow,
Black.
I didn't know that you played drums. That's awesome.
That's something that I'm going to pick up again. I played a little bit. I dabbled back in high school and like the early years that I was in Hollywood. I actually recorded a song on the drums, but like super, super basic. But I can't do a lot of exercise. And I used to date the drummer from Kiss. So that was a fun thing. I've always played him on my steering wheel, but now I'm actually probably going to get a drum set. I think it'd be great exercise. I'm going to be 57 this year. And I think it's the perfect time to learn how to play drums in my garage to headphones and totally rock out. I'm so grateful that you took the time to come on and talk to everybody and share your journey. Do you have any final thoughts or final advice you'd like to share on people dealing with health challenges? And then tell me where listeners can find more information about you or connect with you if they want to learn about your experiences or seek support.
I would say my biggest piece of advice is to trust your intuition. And no matter what a doctor tells you, you can find another one who's going to listen. It took me a very long time to get to where I need to, and I'm still not there yet. But don't give up, because someone will listen to you. If you want to find me, you can check me out on Instagram. My Insta handle is Radican Nutrition. Instagram, I just started, so it has a couple recipes on there. Obviously, some of them aren't within the diet, so I am excited to go forward and make some recipes that are very metal allergy friendly.
Thank you so much. Reminder to see the show notes. Reminder to check out the resources at heavilymetaled.com. Please like and share and follow the podcast, because that helps get us in front of more people. If you don't know about it yet, on the website, there's a petition you can sign to help doctors and hospitals screen ahead of time patients for metal hypersensitivity. And that's going to be a really key deal as we move down the road. Make sure you tell any of your friends who might have those little earring, jewelry, or snap sensitivities about possible allergy to metals, and help us be part of the movement to tell the medical community that we're not going to take it anymore. Thank you. I don't know if you just saw this, but on the screen just popped up a little like, yeah. Do you see that?
I can, yeah. I love
Look
that.
at that. I was getting this crazy. This will be the blooper reel because when I do my thing at the end, it puts lasers behind me. Nope. Oh, there you go. See?
That's awesome.
I don't know where that comes from, but yeah, it started doing that to me. I'm like, why is it doing that? So now I've got a thumbs up thing. I love that. Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetaled.com where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.